Hi, I'm Dr. Rick Klein. I want to go over the simple exercises that you'll need to do after knee and hip replacement. So for all my patients, whether it's knee or hip, you want to walk once an hour. The purpose of walking is to prevent blood clot and to prevent pneumonia. So it is not a walk from your living room, outside, down and over the hill and back. It's really just kitchen and back, bathroom and back. You're not trying to strengthen the hip or knee, you're trying to prevent a problem. You're trying to prevent pneumonia and blood clot. So, again, it's just a simple walk. So what I tell patients is you walk into the kitchen, you turn your oven timer on to 60 minutes, and that will remind you to get up and do it again in 60 minutes. Many of my patients tell me that, geez doc, I didn't realize that 60 minutes went by so quickly. Again, that's where some patients I think are at risk for blood clot by doing it in the old method, which is you sit in the chair for 2 or 3 or 4 hours before you get up again. That's really a mistake. So it's very important to do that simple short walk. So now you've done that simple walk, you come back, and again, all of my patients have to do exercise number 2. That is the simple ankle pumps. So I'm going to demonstrate those for you. It is not up and down. Simple ankle pumps are push down hard. 1, 2, 3, relax. You want to feel that calf muscle. You can see it on my leg. You can see it get real hard. 1, 2, 3, relax. Again, that makes that muscle contract. The blood then returns to help prevent the blood clot. Okay? So, for my hip patients, you're done. You get to ice and elevate and take it easy. For my knee patients, you've got 2 more exercises. So now you're going to work on the knee straightening exercise. My booklet talks about lying flat on the bed or on a couch and pretending that there's an egg underneath your knee and you're going to push your knee flat and break that egg. That's one way to do it. A lot of my patients tell me that my other method, which is not described in the book but is again the same concept, is this. So you take a small ottoman and you're going to put your foot up on the ottoman and you're going to 1, 2, 3, relax. You're pushing down. You're making that knee straighten, okay? And again, I don't want someone else to sit on your knee. That's a mistake. But again, the key is to get that full knee extension. And it is uncomfortable. That's why I'm making that sound with my voice, because I want you to realize that I get it. I know it's uncomfortable. So you do 10 of those an hour, just like 10 ankle pumps an hour. Lastly is the knee slide, or the butt slide, or the heel slide, whatever you want to call it. That's where you get that knee flexion. And so that's where you sit down, you bring your knee back as far as you can. Wow, Dr. Rick Klein's so tight. Okay, I get it. That's normal from swelling. You lock your foot on the floor, and now you're going to scoot forward in that chair, and you make that knee bend. You see how my butt is still sitting on the chair. I'm pushing forward. The angle is increasing. So each time you do one of these exercises, you want it to increase. So you just get as far forward. You count on 3. 1, 2, 3. Relax. Let your leg come out. Take a breather. I know it's uncomfortable. And do it 9 more times. So again, 10 of that exercise per hour. And that's really all there is to it. Now you've done your 8 minutes of exercises if you're a knee, your 4 minutes of exercises if you're a hip. Now again, particularly for the knees, but really for all patients, you want to elevate that foot. And again, for the knee, toes above the nose. You want that foot way up above your nose. For 40 minutes of ice and elevation. In 12 minutes an hour, you get to do what you want. I know it sounds crazy, but if you do that for the first 7 to 10 days, you are going to get better faster. You're going to save lots of money, over $720 on average per patient for physical therapy fees. You're going to have a quicker return of function. 3 weeks, you should be a little stiff in the morning, achy at night, but full motion, no cane, no narcotics, both for the hips and the knees. And again, that's generally 4 to 5 weeks sooner than everyone else doing the rest of the world's technique. All right, so hang in there, and we'll be talking soon at the pre-op visit.